Hi, folks. Good afternoon. What should you be doing as a PSW when your client passes away? Let's find out on JoJo the Caregiving Show. Now, like all compassionate PSWs, I'm sure you are going to be there and want to be there when your client takes their last breaths. But what exactly is the PSW's role when it comes to death of their client? So I think leading up to their death in the final few hours, you're going to notice two of the most common symptoms you should be watching out for is your client's skin color. Usually you're going to notice a bluish tinge to their skin. Usually it's going to be around their lips, their nail beds, their lower feet for sure, and working its way up the legs. This is due to lack of oxygen getting out to the cells of their skin. The body is in survival mode, trying to survive on the inside. So the outside kind of gets less oxygen for that reason. So that bluish tinge is one for sure. And the other major symptom in the last few hours is going to be a change in your client's breathing. Usually you're going to hear gurgling sounds or kind of like a rattlesnake sound, which we call Cheyne-Stokes breathing. This is for sure a sign that your client is approaching death. When death does occur, what should the PSW actually do? Well, a good piece of advice is to be calm, right? Take a few seconds for yourself because you've been looking after your client constantly in the last few weeks of their life. And so it's kind of a good idea to take a few minutes for yourself, breathe, take a few seconds to calm down. But what you want to make sure you get is pertinent information. So, number one, time of death. For sure, the nurse, the doctor will ask you for the time of death of your client. When death does occur, you're going to notify the nurse immediately so she can come down and follow her scope of practice at the time of death. Always give family time alone. Don't be rushing through things with family members that are in the room. Leave the room, provide privacy to family members, and I would say at least a good 15, 20 minutes before maybe you're going to go back into the room. So you want to get the time of death, notify the nurse, and then give family members alone time with their loved one before you're going to come back in. And then basically what you're doing after that is you're following the care plan and also the direction from your charge nurse. And the care plan and other information from the nurse will give you guys direction on what you should be doing next. Usually you're going to clean up the body and prepare it for the funeral home to come and pick up the deceased resident. And you guys are going to be there to confront and communicate with family members as well. So don't be afraid to communicate with family members. It's a part of your role as a PSW to kind of support them through the grieving process, the bereavement process as well. And PSWs usually find that to be one of the most significant parts of their job, looking after their resident at the time of death and then looking after family members shortly after that as well. So I hope you guys continue to provide that compassionate care to your clients until the time of death. It's kind of a good rule to have that you want to be there when your client takes their last breath. And that will kind of give you further purpose in your role as a PSW. Hey, hope that was helpful. And remember to like, share, subscribe, and I'll see you next time on JoJo the Caregiving Show.